Hey guys, Dr. Greg here. And on today's episode, I dove into a bunch of questions from our users on social media with Emily, our in-office hormone wizard. We talked about everything from why you probably don't want to be taking beef liver capsules to the effects of coffee enemas and lots of conversation around hormones. So if you are concerned about hormones or call yourself a hormonal hot mess, this episode's for you. All right, guys, Dr. Greg here, and on today's episode of The Daily Dose with Dr. Greg, I am with none other, the in-house hormone wizard, Emily Anderson. She is the nurse practitioner here at our clinic in Burnsville, Minnesota, and we have a whole slug of questions from our social media followers that are going to touch on hormones, are going to touch on inflammation, and all things functional medicine. So, Emily, welcome.
Thank you.
Here we go again. I love it. Again, if you guys have questions, reach out to us. One of the reasons why I think that we're so successful in the world of functional medicine, with marketing, dare I call it, is that we have conversations with you guys. So if you have a question online, we are live. We are answering questions. We try to be as back and forth as we possibly can. And some of the questions are so good that we're like, hey, the world needs to listen to this one. So this episode is going to be a culmination of a bunch of questions. And so without further ado, let's jump in. All right. In regards to hormones, the conversation of cortisol. So the question is, what happens when cortisol levels are too high? And how do I regulate cortisol levels? So let's talk about high cortisol first.
Yeah, so this is a really hot topic. I feel like cortisol has really come into vogue recently, and it's not necessarily just cortisol, but it's the conversation between the brain and the adrenal glands. And that conversation can happen also within the thyroid gland. And so we really have to know that there's this interconnection between everything. So when there is high cortisol, you can have increased release of glucose from the liver. It's called gluconeogenesis. So you get higher levels of glucose, which then can lead to higher levels of insulin. And then you can get accumulation of belly fat. You can have insomnia. You can have, like I said, blood sugar dysregulation, hair loss. But the question then becomes, do you really have high cortisol? Because I see a lot of Dutch tests for people who say, oh my gosh, I've got anxiety through the roof. Right. My cortisol's got to be elevated. And a lot of times it's actually low. It's low. So that's why testing is so important, because we can really give you a treatment plan that's tailored to you.
What is your opinion on salivary cortisol versus serum cortisol measurements?
Well, I'm team salivary cortisol all the way, because it gives us more, well, first of all, I love the Dutch test because it gives us data points throughout the day. So just looking at a serum cortisol that's arbitrary, it doesn't tell us where it came from and where it's going. Right. So it doesn't tell us about your circadian rhythm or your what we call diurnal rhythm, which is how your cortisol pattern maps out throughout the course of the day.
Okay. So to put that in English for a second, she uses big words. So in a serum test, a person goes to their draw site, and we typically do first morning fasting, and it's at this moment, what is that number? Just dive into the Dutch a little bit and talk about the times that they do the salivary testing that helps you understand that diurnal pattern that you're talking about.
Yeah, so I usually do the Dutch Plus because it gives us an idea of how your cortisol awakening response looks like, or what it looks like. And essentially it maps out your cortisol from waking. So that's the moment you open your eyes in the morning to 30 minutes after waking, and then again at 60 minutes. Now you also are going to check cortisol around 2 p.m. and then in the evening. So we kind of see how the slope falls. But essentially what should happen is you should have a moderate level of cortisol in the morning. It should peak at 30 minutes, and then it should start to fall throughout the course of the day. So that cortisol awakening response essentially is a mini stress test. So it tells us how your body is responding to stressors. So it gives me an idea of what that looks like, whether you're up against a history of any sort of stress. It could be physiologic stress from toxins, inflammation, micronutrient deficiencies, emotional stress, mental stress, spiritual stress. It all acts as a stressor on your body.
That's interesting to say. So it's five tests throughout the day, right? So
5 tests with optional insomnia.
Wake 30, 60, 2 p.m. And then the insomnia would be like at some point in time in the night, they would spit in the vial and say, what the hell's going on? The other thing I think that's important that you said is how glucose can come alongside of that. So would you expect to see, okay, so let's say that someone has high cortisol, which we don't see a lot of, We have seen it in a couple of cases though, right? Even recently, you and I shared a case and we're like, whoa, this girl's cortisol is like through the roof.
Yeah.
And it was actually last night that I had a conversation with her. She's like, hey, about that cortisol number, here's what happened the 24 hours leading up to that time. Could that have an impact? And I was like, yeah, but probably not all the way to 36.
Yeah, that was a doozy.
So let me ask you this though, just because you don't care for it, is it like, for example, if let's say that we did a serum test at 8 a.m. and a salivary test at 8 a.m., would they at least be consistent?
They should be.
Okay. Okay. So really why you like salivary testing is you can look at that whole bell curve and just kind of see like big picture, where'd you come from, where are you going and whatnot. Okay. So the thing I think I talk about with high cortisol is I'd rather see high cortisol than low cortisol, right? Because then the person actually has the ability to make cortisol.
Exactly.
Going back to blood sugar though, so I would expect to see a person to have elevated blood glucose with elevated cortisol. But I don't think the same as the opposite. If we have low cortisol, do you still see high blood glucose?
Sometimes, and it kind of depends on what happens first. Is it the chicken or the egg? So,
Okay.
so cortisol isn't always the reason for insulin dysregulation and glucose metabolism disruption. And so a lot of times insulin can happen on its own with insulin resistance and
Yeah.
poor glucose metabolism. And so it may not always relate back to cortisol.
You know, the thing that I'm finding, and we've seen this because, so our clinic kind of has like, dare I call it, two arms, right? We have this like chronic infection, chronic toxicity, and then we have this hormonal component, which obviously does a lot of infection and toxicity with it. Though it's so common that I see a person that has a stressed system, right? Liver stress or gut stress or infection, and they have elevated hemoglobin A1C and elevated glucose. And I've never seen this in literature. However, it's kind of my guess is the body is elevating the glucose numbers because it's just low-hanging fruit, as opposed to shove it in the liver or the muscles. It's like, okay, I don't have any extra energy to work for this, so I'm just going to keep this handy. So then that forces this whole weight loss resistance potentially part that comes with that.
Yeah.
So I like one of the things that you like, for example, like ovulation test strips, because then people can like look it on their own. I also am a fan of, if people are running elevated blood glucose, even doing some testing at home, right? Some blood glucose testing because you even talked about like that insomnia pattern, like yeah, we're curious what the cortisol is, but I'm also curious, like, what's the blood glucose? What's going on there?
Right.
I have a few patients, as we share, that have GCM, the continuous glucose monitors, and it's not uncommon that we see midnight 2, 3, 4 a.m. spikes of the interesting. So
Right. And it's relatively inexpensive, right? Even if you go to your local drugstore and just get a glucometer, they're $18.99 type of thing.
and pennies to test.
Absolutely.
Each
yeah.
one.
Yeah, and it can provide a lot of valuable information, even how your body's responding to different foods throughout the course of the day. You know, you may respond really poorly to a banana and really well to a cookie, whereas your neighbor responds completely the opposite. So
Exactly. Okay, so now let's jump into high cortisol versus low cortisol. What I was taught, and correct me if I'm wrong, I did some training through Dr. Kalish's Institute 10 years ago. The typical appropriate physiological response, right? Like I tell the story. I used to live in Duluth, Minnesota, and I was out on a trail run, and I literally came across 2 black bear cubs.
so you had that response.
Where there's cubs,
Yes.
there's a mama, right? So I looked around and I saw the mama bear, and literally, like, my palms got sweaty, my pupils got big, and I was like, get the hell out of here, right?
Yep.
So what I was taught was that an elevation of cortisol in an appropriate response is appropriate, right? That's the right thing to do.
Absolutely.
Now, in my case, I got home, and it was probably like 3 hours later that I finally felt myself go, okay, I'm not bear bait
Yes.
today. And then we'd assume that if I was measuring my cortisol, that I would see this spike, appropriate spike, right? Sympathetic drive, and then this come down that's like, all right, dude, like, you're gonna live. But then what I've learned is that, like, a lot of people like mama bears in their living room.
Yeah.
So what I was taught was that we initially have the ability to produce all this cortisol, and then there comes a point where your body's like, yo, that factory's done. and then we see that drop. So would you agree that we typically would see an elevation, and then if it's burnt out, then we'd see that bottoming out?
Yeah, it used to be actually called, phase 1, phase 2, adrenal fatigue, phase 3 type of thing. And that's sort of come out of vogue. And now we talk about the whole HPA axis dysfunction. But yeah, absolutely. And there's still some data points where we can say, if you've got 1 point elevated outside of the normal range, it's phase 1 versus phase 2. We don't really quantify it in that manner anymore.
Correct.
But you're absolutely right. We start seeing changes in DHEA too, which is sort of the counterpart to cortisol, where if cortisol is high for a period of time, DHEA is going to drop because it's sort of trying to antagonize cortisol to kind of maintain that balance within the body.
Yeah, that's so good. So if you're listening to this and you've had some of this lab testing done, I guess the first thing is the numbers know better than the interpretation. And when it comes to a hormone like cortisol, it also depends upon when was the test taken. Right. So truly, I agree with you. The gold standard of cortisol testing is salivary response testing because it's dynamic. Oh, and by the way, for those that have had hormones tested through their serum, by the way, it's still the gold standard way to do it. I will also tell you that hormones change 25% in a 24-hour period. So that's a tough thing. So even if you're trying to, and not only that, then you have the time of your cycle. So if you're a female and you're doing hormone testing and you're trying to measure apples to apples, that's why, for example, we talk about the luteal phase of testing, and we also talk about a first morning fasted so that we at least have some consistency.
Right. Especially important in men too, because you've got this 24-hour production of testosterone where morning time is really the ideal time to get it tested.
Interesting. So let's talk about the testosterone wheel then for a second. So what time of the day, what happens to testosterone in a day in a typical guy?
Testosterone's typically highest during the morning hours, and then it starts to fade throughout the course of the day. Women have a 28-day cycle. Men have a 24-hour cycle, so to speak. So
that means I have PMS every single day?
There you have it.
Lovely. There you have it. Now, so let's talk about so then is it we talk about having a morning erection. That would be a sign of an appropriate amount of early morning testosterone elevation. So that's a good thing.
It's absolutely a good thing. Nighttime erections, morning erections, you want to make sure you're maintaining those.
Yeah, okay.
Tell us a lot about our bodies. Well, not my body, your body.
Right, true story. So what happens then is what you're saying is that testosterone peaks throughout the day. And then does it fall off like cortisol kind of does? Or?
It does. I mean, not in the same significant slope, I would say, as cortisol, but yes, your testosterone levels are going to be highest in the morning. So we typically try to get it done.
Does testosterone, or even, I guess, so let's just talk testosterone for a second. So let's say that someone's listening to this and they have a healthy relationship and they're going to be intimate. Does a man's testosterone change in the anticipation of connection with their spouse, for example?
Potentially. I mean, you get hormones. You may get some change in receptor sites and things like that, just with the sort of feelings that you have, changes in neurotransmitters.
Yeah.
So
that's interesting.
It would be, actually, I haven't done a whole lot of research on that, so it's kind of interesting, something I might have to look into a little bit more.
And I think, it's obviously the goal is that healthy marriages have healthy together time. And a lot of guys don't talk about how things below the waist are doing. Yeah. So it's super common. So if you're a guy and number one, you're not waking up with a morning erection, that's a sign. That's not necessarily a good thing. And there are a ton of medications that will just smush testosterone. I will also tell people that the top things that kill testosterone for guys, and I assume it affects testosterone in women as well, but number one is stress. If you are stressed, your body's like, yo, we're just not going to go down that pathway. Number two is poor sleep. Poor sleep is one of the biggest killers of testosterone. And then chronic cardio. I see people that are marathon runners, endurance athletes, super, super low testosterone in guys. Yeah. And respectfully, I was that guy. I did a Ironman triathlon 10 years ago, and I was a hot mess. After that, I mean, I looked great per se. I was super skinny. I was actually way too skinny, but I was a hormonal, just straight up hot mess.
And you felt it symptom wise?
What I felt was, I mean, I had boy function, but what I felt was just a lack of wanting to just go outside and do anything, right? Even though I was an endurance athlete, I could go for a 13-hour race.
Yeah.
So,
Well, it's
and it took
interesting you
time.
say that because typically that's the last symptom to occur is the lack of erections.
Right,
So
right,
a lot of
yeah.
times I see testosterone 250 and anything less than 300 per the American Academy of Urology is low T or hypogonadism.
What would you say is potentially low T for a guy?
Well, it depends on age. So, if
Okay.
I'm looking at a 65-year-old and I see a testosterone of 450, I'm like, okay, that might work for you.
Okay.
But more and more, I'm seeing men come in who are 25, 30 who have testosterone levels less than 300,
Right.
which is alarming. And they're changing the value from a conventional medicine standpoint based on the trend that we're seeing. So it's not that
So they're dropping it lower.
yeah, it's not that things are, normal. It's just that the trend has changed over time, which is alarming.
When you've worked with some of those men, I just talked about some of the things that I've seen clinically. What are some of the common denominators in their world that you're like, oh, do you have this or that? Or what are some of the common things that you've seen?
In terms of symptoms causing low T? Or?
Lifestyle, exposure,
Yeah.
like things that were like, oh yeah, that makes perfect sense.
Well, I would say EMFs. So putting your cell phone in your back pocket is kind of a big no-no because it's right next to the
Boy parts.
the boy parts
Yeah.
that produce the parts or
Yeah.
produce what you need
Now,
for
some people think
testosterone.
that's all woo-woo, but the research is getting better and better
Yeah.
on those frequencies being that close.
Absolutely.
So,
Lack of sun exposure is another one. There is research showing that sunlight, especially in the morning and then again in the afternoon, can help to prime testosterone levels, can help to optimize cortisol levels.
Okay.
So that one's another one, especially if we're working from home inside. We don't leave the house anymore to go to
Yeah,
work. We're just
totally.
inside the house all day long.
Yes.
That's a big one. I think any sort of stress, physiologic stress, mental stress, emotional stress, a lot of people say, well, I don't have any different stress than I had a couple years ago, but I got a divorce and all of these things that maybe don't register as physiologic stress, but
Right.
if it's mental, emotional, spiritual, it still counts.
And then it accumulates
Yes.
over time, right? So lots of conversation around hormones. There's a lot of buzz, right? I mean, even like in the male hormone world, there are these male hormone replacement clinics on every corner. And I'm not trying to say I disagree with what they do, but what I will say is not every answer is here's some testosterone, right? You need to take a look. And sometimes, I always say the body responds appropriately to its environment. So if you can change the environment, wouldn't that make a heck of a lot more sense than like, hey, just inject yourself twice a week and
Right.
you're good to go.
There's a reason that your testosterone's low.
Yeah.
It's not that you were given the opportunity to have testosterone replacement therapy. It's why is your testosterone low? How can we fix that problem so that
Right.
your body can create its own?
So true. So true. Okay. Jumping back into the questions. I promise that each question moving on will not be as long as this first one. Claire asks, does eating beef liver help combat non-alcoholic fatty liver? And if not, are there any other supplement recommendations? Have you ever eaten beef liver?
I haven't. I've heard of people taking it in a supplement form.
Yeah, totally. That they do like non-desiccated liver.
Yeah.
Mom, I love you. And yes, I remember eating liver and onions as a little boy. It's nasty.
Yeah, I've heard texture-wise, it's just not great either.
It's got a very interesting texture to it. And I don't care how many onions and butter you put it into, it's just interesting.
Yeah, I mean, it wouldn't be my first choice for combating non-alcoholic fatty liver disease, I'll be honest with you.
Right.
I don't know, what's your take on it?
That's a good question. I think the question, because I come from a ranching background, right? I'm like, okay, talk to me about that cow.
Yeah.
What
Right.
was that cow exposed to? How was that cow raised? Was that cow given antibiotics and growth hormone? Well, how did that cow? How was it? What did it graze on? Did it eat silage and corn all day long, or was it out on an organic pasture? I mean, here's my catch with people using liver as a supplement. The liver is a detoxification organ. So even if that cow is grass-fed and free range, it still is exposed to toxicity. And so I guess, and I'm sure some people are like, oh, he's crazy. He doesn't know about the whatever supplement. But I know about the liver, and I know what the liver does in the body.
Right.
And there's no animal on earth, no cow on earth that is hermetically sealed with an unexposed liver. Now, if you're dealing with non-alcoholic fatty liver syndrome, you can't be dinking around. Right. So the first question I would ask is, by the way, here's not a supplement for you, but why You always have to ask why. Why do you have non-alcoholic fatty liver syndrome? What's going on? Why is your liver responding that way, right? And in our world, we look at infection, we look at toxicity, we look at things like leaky gut, we look at hormone imbalance. So you have to start there.
Yep.
Because here's the scoop. If you are full of infection, or you have chronic Lyme disease or Epstein-Barr virus, and you take, I don't care what supplement you take. Like, for example, we love Advanced TUDCA, amazing product. We like KL support. We like other things. If you're taking those all the while your liver is still dealing with this burden, you are putting a Band-Aid on a bullet wound all day long. Right. So that's my take all the time. And this world, don't get me wrong, and God bless you guys, you want the simple fix, and if there's an easy answer, give me the easy answer. Yet it's not, it doesn't work that way.
Right.
Especially when you understand the liver. Now, if we talk about the liver in regards to hormones, now we could teach a weekend seminar, right, about estrogen and progesterone utilization and downstream estrogen metabolize. So you have to, so number one, I guess, how do you know you have non-alcoholic fatty liver syndrome? To my knowledge, isn't it a liver biopsy that is the definitive diagnosis of that?
I think ultrasound can give you some guidance there too, but definitively, yes, I would say it's a biopsy. And I don't think they're doing a whole lot of liver biopsies to diagnose that these days.
Now, there are good labs, right? Like albumin, globulin, AST, ALT, alkaline phosphatase, triglycerides. These are all things that will tell us like what's going on with the liver. And I love the fact that the liver is getting some attention finally.
Yeah.
And I think I've said for years, and I'll say it till I go home, that it is the most overworked, underpaid organ in the body all day long. So I guess we do use supplementation when the time is appropriate. We do use things like coffee enemas. We're going to talk about those in a little bit. Though ultimately, why is your liver stressed? What's going on in your system that your liver is actually responding appropriately? So, and then supplements. So let's say that we're working with someone and we're doing the work, and now we know that we are actually going to support it because we're addressing the why. So what are some of the top things on your supplement list that you like for liver support?
Well, my favorite is Advanced TUDCA. I think it's phenomenal. We use Cellcore products, and that one's got some great drivers in it, like melatonin. I actually just had a conversation about TUDCA with somebody. They said, well, is Cellcore the best one out there? And I said, well, as far as I know, it's really the best one that has all the evidence to really show that it does what it's intended to do. But, obviously, you want to thin the bile. You've got every drop of blood filtered through that liver every 3 to 6 minutes. So you want to make sure that you're supporting that liver. The other one that I'd mention, and this is just general detox, is doing a lymph massage. So making sure that your lymph system is flowing, because your lymph is like your sewage system. So if you want your liver to work, you want to make sure your lymph is also flowing. So that's a big one. We use KL support as well. That's another great one. Milk thistle. Those are some of the big ones that I can think of.
So before I get to the next one, without like giving us a full-on demonstration, explain what a lymph massage is.
That's a really great question. So your lymph, like I said, is like a sewage system. So imagine, you've got sewer water in your body, and or lake water, and if anything is stagnant for too long, you can develop grossness in there, for lack of better words, right? So you want to make sure it's moving. And in order to do that, you actually have to kind of put your hands on your body. Now, you can use things like dry brushing, you can use things like contrast showers, but the way that you actually put your hands on your body is really important, because your lymph system is also in sort of like a pump fashion, and you want to make sure you're draining it the correct way. So you always go sort of up and out. So you start here at the collarbone. This is about where 85% of your lymph drains in. So you want to make sure you're really spending a lot of time.
Is that the thoracic duct?
The thoracic
there
duct,
you go.
yeah.
Cool.
Yep. So this is supraclavicular and subclavicular. So you've got your clavicle here, up and below it. And then you want to really work on both of those sides. And then you want to go up. So right behind your jawbone here is the other lymph node that's really big. Again, 2/3 of your lymph nodes are above your shoulders here. So you really want to make sure that you're moving all your lymph. Your lymphatic system is in your brain. A lot of people with brain fog, they have a big problem with stagnant lymph. And then you want to go to your axilla, so your armpits, really. And you can vary your pressure. Move hard, move soft, hit the area.
So is it just like over your Prada glands, is it like you're milking those things?
You
or?
can, yeah, you
Okay.
can. I mean, and again, it's
Just get it going.
Just move
Just
it,
give us some
just
help.
however it is, and it's really behind the jawbone here. So
Okay,
this
so it's
one
not
right
it's
back
not on
here.
the cheek. It's behind.
Correct,
It's
yeah.
behind the jaw. Okay.
And you can kind of push things through. I mean, whatever feels comfortable, right?
Okay.
So then we move to the axilla, and then we move to the belly. Nobody touches the belly,
The
right?
gult, yeah.
Even when you're in a massage, nobody touches that. But
Yeah.
you've got 60% of your lymph and your immune system and all of this stuff
Yes,
kind of
yes,
lives
yes.
in there. And your liver actually makes, I think it's about 50% of your lymph fluid as well. So,
Oh, that's awesome.
yeah. So then moving down into the inguinal. So this is right kind of at the crease of your legs and then behind the knees. And that's six spots.
That is so interesting. I love that. And how often should a person address those areas?
I recommend daily, not too much too fast, just because it can induce sort of like a Herxheimer reaction. So a little bit
Okay.
of that detox reaction.
Yeah.
But once a day, and then if you feel like you're moving and grooving, you can try for twice a day. Some people like doing it in the morning because it gives them energy, mental clarity, focus. Some people like doing it at night because it helps with sleep. So,
But it costs a lot.
yes, super
So
expensive.
expensive.
That time, right?
Yeah, and I think that's what people sometimes forget about, the low-hanging fruit, the easy things that are free, that work. So yeah, lymphatic massage, clutch part of just self-care, right? And it doesn't take much time. It's interesting because I have a physical medicine background that's really strong as well. Like you talked about, like the back of the knee, the popliteal fossa. And I will tell you that in my history, I used to travel the pro rodeo circuit and work with all kinds of professional athletes. The number one area where I would see ankle and knee dysfunction is in that area. So now I'm like, I wonder how much of that was stagnant lymphatic tissue as opposed to a dysfunctional popliteus muscle, for example.
I just saw a woman with lymph nodes the size of golf balls.
What?
And yeah, they're huge. And she's got brain fog and anxiety, and her whole body just feels like it's tight. And I said, we got to move that lymph.
Whoa.
So, yeah, I mean, it's low-hanging fruit that I think everybody should start with. Again,
Okay.
if you've got, so essentially you've got this interstitial fluid that sits right next to the cell. And if that's dirty swamp water, right, nothing is going to get into that cell. So we
So
can give you
true.
all the supplements in the world, and nothing is going to get to those if you've got all of this problematic lymph fluid that's
It's
hanging
also
out.
why we want to move,
Yes.
right? Like this is why why movement is so important. Like go for a walk.
And breathing. Breathing is the
breathe.
biggest pump you have in your body, your diaphragm.
I could go into a whole
You're right.
spiel about the right side of the diaphragm and the liver, and I think there's a lot to that, right? Like we are designed to move, and so lymphatic drainage, lymphatic massage, that's clutch. I like that. Okay, let's talk about putting coffee up your butt for a second here. So I have been a student of coffee enemas for about 15 years now. I was formerly trained in the Gershon cancer method about 15 years ago. By the way, we do not treat cancer patients in our practice. It's not our specialty. Though one of the things that I gathered from Dr. Gershon was the importance of the liver and how he utilized coffee enemas inside of that. So the question is, won't using a coffee enema strip my gut of good bacteria? I've been trying to rebuild my gut flora with probiotics. What would you say to that person?
Well, I'm going to turn it back over to the coffee enema king over
Yeah.
here.
That's a good question, and I have had that question multiple times right now. So here's the thing to understand: a coffee enema is not like a 3-liter fleet enema. You're only putting like 1 to 4 cups tops of coffee up your butt. So you have to understand that you have pounds of bacteria that are way further up your intestinal tract. So now, if you started doing like 2-gallon coffee enemas, yeah, you could totally clean out your world. The catch though is they don't, and a lot of people think more is better, but you have to understand that the hemorrhoid vein comes into the descending colon only about 4 or 5 inches from the exit point. And the benefit of the coffee enema is the exposure of palmitic acid and caffeine to the hemorrhoid vein. So anything more than that is no good. So I had a patient, one of my patients from Canada, she's just a peanut. And she's like, Dr. Greg, your video said do 4 cups, but I really can't hold it in there that long. I'm like, girl, you're just a peanut. You're just itty bitty. So I have her doing just a cup. And she's like, oh, that's a heck of a lot easier for my body. Now, with the conversation of inoculating a gut, this is kind of like 2 questions in one. probiotics are a great way. The question, though, without my catch always with probiotics is this: does it get to the gut, and is it live, and does it have the prebiotic to give it the fuel that it needs to proliferate? So now, I am not condoning this on this video. Remember, these videos are just for entertainment purposes and not medical advice, though I have had several people like post-colonoscopy do probiotic enemas to re-inoculate the gut. I actually learned this, many years ago. We had a patient, a little girl actually, that after a pretty heavy dose of antibiotics because of a sickness, she started to have seizures.
Oh, wow.
And my pea-sized brain was like, hey, like her gut is sterile. And we actually did a probiotic enema, and her seizures were done.
Wow.
Isn't that crazy?
What age do you typically start recommending coffee enemas, or does it kind of vary?
That's a good question. So, okay, putting coffee up your butt like takes some mental fortitude. And it doesn't hurt, or it's not, but like it's uncomfortable for some people. So there's not really a magic age, but it's really, so if we're going to go young, it has to be like, let's say it's a kid, like at least middle schooler, if not older. You have to understand like their level of mental capacity. Like, do they understand what they're doing? And do they understand why they're doing it? And are they with free will, like, yeah, I'm okay with that. Just talk me through it. Or is it being done against the will? Or do they have to do it? I mean, I had a patient, I talked about this guy a lot. I had a patient 10 plus years ago. He's like, Dr. Greg, I'm not going to do them. And I was like, don't you want to get well? Like, what the heck? And he came back and he's like, Dr. Greg, I just want to talk more about that with you. He said, I was sexually abused as a little boy by an uncle. And I was like, dude, I'm so sorry. So there is unquestionably the possibility of extenuating circumstances. Now, as nice as I can say this and as loving of a tone as I can say this, if you're like, yeah, I kind of don't want to do that, then I kind of want to wonder, like, how motivated are you to get well? Because I guess I do have a pen here. This is how big the thing is that goes up your butt. Okay. So if you're like, oh, I mean, hopefully your poops are bigger than this. So it's not like it's going to damage things or whatnot. Yet, if you've had trauma, I get that, but I do not believe that the coffee enema will sterilize a gut like a gallon of Go Lightly would do so, or a big probiotic or antibiotic regime. So that would be my take on that. The second question would be, can I do coffee enemas if I am breastfeeding?
I say go for it.
Yeah, here's my kind, and I try to be kind of like a little cautious in some of those things. So sometimes the lawyer has to talk, and then the old cowboy doctor gets to talk a little bit. So what I typically tell women that are nursing is, if you've done coffee enemas prior to nursing or prior to pregnancy and you were good with it, then there's no reason to say no. Now, if you've never done anything that looks like a coffee enema, and now all of a sudden you're breastfeeding and you're like, hey, I think I want to try this. Like, what else are you trying? Like, what are some other tools that you're using? The reality though, if you're going to do this, you have to start super low, like half a cup. Yeah. Then also, if you're nursing, pay attention to your little peanut, right? If you do a coffee enema and now your kid is screaming through the night, unfortunately what's happened then, and it's possible but rare, is that for whatever reason you've probably expressed something through your breast milk that's gotten into your baby, and then they're responding inappropriately. So I would say that. However, the longer I've been in medicine and the more I've been around, my wife, by God's grace, nursed all of our babies. It is amazing how the women's body can give that baby exactly what it needs. Yep. I've even changed my take a little bit on, like, let's say someone taking like a small anti-parasitic when nursing. Like, because here's a scoop. If mom has parasites, the baby's got parasites. So, like, oh no, don't take that and nurse your baby because I, the doctor, know exactly what your baby needs. Like, what if the mom's body, like, what if we gave the mom a small dose of an anti-parasitic, and what if the body is like, I'm going to give my mom a dose of this to my baby through the breast milk? So I've changed my tone a little bit in regards to nursing mommies and like a little bit of anti-pathogenic work. So anyway, maybe I'm just getting old.
No, I mean, I think it's amazing what the body can do. Even, when kids are sick, your body makes antibodies to create breast milk designed for that child, which is just, I mean, it blows my mind when you think about it in that way.
Right.
So
And I mean,
it's pretty
we now know that when the saliva of the baby hits the areola of mama's breast, the innate intelligence of the mom alters the bowel makeup, the macronutrients, the micronutrients, the immunoglobulins of her breast milk to give her baby exactly what she needs. Now, and this is not a conversation of condemning bottle-fed babies. Like, I get it. It's not that conversation. However, I will unapologetically say on the record that nothing matches mama's milk ever.
Yeah.
So,
Absolutely.
and the connection. I mean, my wife,
Right.
other than getting bit, I guess, which I'm sure every mom has probably experienced that at
Been
some
there,
point
done
in
that.
time. Like, whoa, hey, no, don't do that. So, okay, so that's coffee enemas while breastfeeding. Let's talk about osteoarthritis, obviously an inflammatory component. We see a lot of that because a lot of our patients are perimenopausal or menopausal, and osteoarthritis is a real thing, right? It is a real risk. And I'll say this before I hand it off to you. You cannot take a calcium supplement and expect to have strong bones.
Right.
It's the same as taking creatine and expect to get big muscles. Like, there has to be an activity that happens inside of that. But in regards to perimenopausal and postmenopausal females, talk about osteoarthritis.
Yeah, so I mean, it's pretty common, and I would say even more than calcium, vitamin D for bones. But we do see it a lot, and there's a lot of estrogen effects that happen with the bones and the joints and the lubrication within the joints as estrogen starts to wane a little bit. And so we find that using a little bit of estrogen, whether it's in a cream form, in a sublingual form, combined with, some light weight-bearing activity, really does help to benefit women who are experiencing osteoarthritis type symptoms. And then also, while we're on the topic of that, even osteoporosis. We know that that's such a significant impactor of women's health and longevity. And so estrogen is a huge benefit for that piece of it too, along with, of course, vitamin D and weight-bearing activity. So.
One of the things that I really have loved that I've learned from you in regards to perimenopausal women or postmenopausal women and estrogen and then like Dutch testing is we do know that there are, like, if you're a listener, you've heard of estrogen dominant diseases. Like, they're a very real thing, right? Like many breast cancers and ovarian cancers and uterine cancers can have a very, even breast cancer in men, it's kind of a not talked about thing. It's real though. So there's this huge conversation of how are you processing estrogen? So what you just said is, hey, estrogen is beneficial for postmenopausal women. And then I just said, hey, you can have estrogen dominant diseases. So the Dutch test comes into play to ask how the body is processing that estrogen. And the nice thing about the tools that we have clinically is if that person is a aromatizer or they're a bad processor, we can actually divert the processing or the aromatization of that estrogen so they can both get the benefits from estrogen but then not become an estrogen dominant disease person. The thing that got me though is actually giving some women a little bit of estrogen to see what they do with it. Because I think a lot of, I am going to go on the record to say, I believe that a lot of women that are, even do Dutch testing, don't even ask the question like, hey, here's some estrogen, what are you going to do with it? So walk me through the importance of how to do a proper Dutch test on a perimenopausal or a postmenopausal female.
Yeah, so there's a couple options. Obviously you can do one without any sort of hormone replacement therapy and just see how your body's processing estrogens. We can still see how your body kind of metabolizes estrogen down what I call the good, the bad, or the ugly pathway.
Yeah.
And obviously the ugly pathway, you're putting yourself at more risk for developing DNA damage, which then can lead to breast cancer, ovarian cancer, and that piece of it, and just oxidative stress in general. But then the other way that we could potentially look at things is by starting you on a little bit of hormones. So again, I like to balance estrogen with progesterone. So I typically do the combination of the two. And then doing a Dutch test, let's say 3 or 4 weeks down the road to see how your body is utilizing that estrogen. Now, there are a couple nuances to that. If you're using sublingual estrogen, we have to be really careful with the salivary samples that you're not, or the urinary samples, that you're not contaminating that piece of it. But it does provide us a lot of insight into how your body's utilizing it, so we can make sure that, if we need to use things like DIM or Indo-3-carbinol. These are things from cruciferous vegetables to kind of push estrogen down the more beneficial pathway, or kind of dial back the estrogen amounts that we're giving, or make changes to it. We're able to do that sort of on the fly, given the.
So it didn't sound like you said that both are possible. Does one give you clinically better information?
If someone wants to do hormone replacement therapy, I'd say let's do both. So we do one at the beginning, and then we do one, once we start the hormone replacement therapy.
So you do one of each, one without.
Yep.
How are you all by yourself?
Yep.
And then down the road, how are you doing with a little bit of?
Correct. And we can still see, if your body has, so a lot of times we can see genetic, what we call polymorphisms. So if you've got any sort of genetic variation with something called the CYP3A4, we can see how your body's kind of processing estrogen based on that. So it gives us some insight into just genetically how you're predisposed to process estrogen, and then with what are you doing with your current level of estrogen. We all have a little bit. We can kind of see some patterns just based on that.
Yeah, definitely. Typically, we see a less than 10 number on the lab and from the serum standpoint. Cool. Well, hold that thought. Let's take a little break for a commercial break, and we'll be back with a few more questions.
This podcast is sponsored by Life Boost Coffee. Clean, organic, and non-toxic ingredients are important for your health, and Life Boost Coffee is no exception. Go to coffeewithdoc.com to receive 50% off your first order. That's coffeewithdoc.com. Hi everyone, this is Ben, one of Dr. Greg's producers. We appreciate you tuning into the Daily Dose with Dr. Greg. We're so grateful for every single one of our listeners, and we know that our audience is expanding all over the world. If you are interested in working with Dr. Greg, Emily Anderson, or Vitae Clinic, all you have to do is click the link in this episode's show notes. We want to bring people as much value as possible, so if you personally enjoyed this episode, please share it with your friends and family. Also, we welcome your comments, feedback, and questions on any of our social media platforms. Feel free to reach out anytime. All that said, let's hop back into today's conversation with Dr. Greg and Emily Anderson.
All right, guys, we are back, and I'm back here with Emily Anderson, our hormone wizard, like I like to call her, in our clinic here in Minnesota. By the way, if you're interested to be a patient of ours, we literally treat. Here's a shameless plug for ourselves. We treat people all over the nation here. We have the ability to order labs, and especially if people want to do hormone-specific work. There are some laws that we are governed by. We get to play by the rules, but we have people that fly in and see us, and then respectfully, the rule is, and it can change depending on when you're listening to this podcast. If Emily sees you in person for once, the current law states that she can manage you and prescribe or unprescribe for the course of a year. So for some cases, it's been a huge blessing to have that at people's beck and call from that standpoint. So let's jump back in and let's talk about, this is a question from Barb. Barb, poor thing, says, I have Hashimoto's, thyroiditis, gallstones, heavy periods, fibroids, and tons of estrogen. Where does this come from, and how can I help flush estrogen?
Yeah, it's a really good question. So there's really two ways or two things I'll talk about. The first one is too much estrogen in. So is that coming in the form of endocrine disruptors? So things like plastics, phthalates, artificial fragrances, and or is it poor detoxification? So is your body not able to get rid of it? And a lot of that getting rid of it process, we talked about the Dutch test and how important that is. We can see a lot of it on there. So we talk about liver, we talk about gut. Again, if you've got any sort of dysbiosis, you actually have something in your gut called your estrobolome. So it's essentially how your body is processing estrogen and that piece of it. And so with gut dysbiosis, you can have higher levels of something called beta-glucuronidase. And this is an enzyme that sort of goes in and acts like scissors to break up estrogen from its binding protein, so that when you're supposed to be getting rid of it via your stool, you're actually reabsorbing it in the gut. So you can see a lot of estrogen reabsorption in that pattern. So we kind of want to, through testing, we can see whether it's too much estrogen in or not enough estrogen out.
So let's go back and give Barb, let's break down some of those big words. So where would Barb have plastics in her day-to-day use?
Well, I think the statistic is, don't we like eat a credit card per week or something like that?
Oh my gosh.
I feel like it's that.
crazy.
I mean, anything in food that you're eating. I mean, I try to avoid any sort of plastic food containers where you're especially heating things up in that.
Yeah, definitely no. If do not microwave
Yeah.
in plastic. I'm not a fan of microwaves anyway,
Yeah.
but for sure not in plastic.
Yeah.
Okay.
So avoiding plastics there. We talked a little bit about the phthalates and fragrances, so like candles, the plug-ins, anything artificially scented, try to get rid of it, replace it with things like essential oils.
So the
natural
things that you're
scents.
putting in your vents in your
Yeah,
car,
right.
the plug-in scent stuff, fabric softeners that
Mm-hmm.
are scented, anything that has artificial fragrance, even a lot of perfumes
Yeah.
are just nasty.
Yeah.
So endocrine disruptors is
Yeah.
what they're called. And some of them can act as fake estrogens or something called phyto or xenoestrogen rather, and come in and push that. So
We test for parabens too. I see a lot of methylparaben come through. That's things in cosmetics, lotions, soaps, hair care products, makeup.
it's
So-
got to be tough to find healthy. I mean, it's getting easier, I'm sure,
Yeah.
than it was 10 years ago. Let's just go there for a second. Like what's your go-to place to find stuff for your skin that isn't going to crush your estrogen?
I have two. So the Environmental Working Group has an amazing app where they
Yes.
actually have a barcode scanner. You can take it to the store with you. You can scan the barcodes before you buy it so you know whether it's
Okay.
good or not based on their rating. And then the other one is Yucca. That one's another really great one. It's got a barcode scanner, so you can kind of do the same thing. You can manually input it, but it gives you the score based on like a 0 to 100 score, so you can
Right.
see how green it is. And there's so much greenwashing nowadays. I mean, you see these labels, it's like no sulfates, no parabens, but then on the back you see like phenoxyethanol, which is another not great one. And so all
Exactly.
these things that they're trying to
So
mask.
realistically, if someone walks into Ulta or Walmart or Target and they start scanning stuff, are they going to be like, oh,
Absolutely.
Okay.
Yeah. Yeah. And it's to the point where, I mean, Target is starting to kind of carry some of the more, because it's something that I think is more talked about now.
Right.
So you can find some of the better brands. I mean, they're
Okay.
not perfect, but as long as you're going a little better, I'm good with that.
I know,
right?
like
little
there's
bits.
right, there's this thought that if it's not perfect, it's all bad.
Mm-hmm.
And what if it's just a little bit better than it was?
Absolutely.
Right. So there's a lot to that. So
Progress, not perfection. Right?
Progress, not perfection. Angie Song from Instagram asks us, how long can someone be on estrogen replacement therapy?
That is a great question. And again, I think it all depends on how you're monitoring your estrogen therapy. If you are just doing estrogen alone, I would say make sure you're also taking progesterone because those two are very much a balance. Estrogen I kind of refer to as the gas pedal, whereas progesterone is the brake, and you don't want a car without a brake, right? So you want to make sure that you're balancing the two of those and then also testing appropriately. So you want to make sure that you're really Dutch testing and not just serum testing because it
Yes.
doesn't give you all the information about how your body is processing these.
Okay.
I've seen women who have been on estrogen therapy for a long time, have never run a Dutch test, and we run it, and it's like, oh my gosh, I can't believe
You're a hot mess.
this is happening, right? And this has
Yeah.
been happening for this long, and it's putting you at a higher risk of potential DNA damage. So, and I've met women who say, I will die of cancer before I go off of this hormone therapy because it makes me feel so good. So
Right.
I think it's really just independent of how you feel on it and what it's doing for your body. There are so many benefits to estrogen therapy combined with progesterone that I say do it until you can't do it anymore.
Right.
So
And some people are kind of like super naturally minded. They're like, oh, I don't want it because it's prescription and therefore it's not good or it's synthetic. Could you speak to those peeps a bit maybe?
yeah, well, and I typically use a bioidentical progesterone. So what that means is you've got sort of this lock and key receptor site in your body where estrogen binds into that receptor. And so the bioidentical fits into that lock and key receptor site just like your own does versus synthetic, which kind of goes in and jams the lock and creates a whole host of other potential side effects. So that's where bioidentical, it uses things like Mexican wild yam,
Wild
and
yam, yeah.
these other things that are more naturally occurring. And it is compounded at a compounding pharmacy, but that doesn't mean that it's, a prescription synthetic medication.
Yeah, I think that's the misconception is because it comes from a compounded pharmacy that it's like some chemistry makeup set. Not necessarily. The catch though, what we've found is like even like take DHEA for example, a product from a compounded pharmacy is typically way more effective than the DHEA that you'd find on a vitamin shelf because there's a purity, there's a consistency of dosaging, there's just so many stability. There's a lot of things that come into that.
Absolutely.
Cool. Well, there you have it. So I think the thing that's important is when people say estrogen replacement therapy, we're really talking about hormone replacement therapy because there's more than just estrogen in this game. And you have to be looking at testosterone, you have to look at progesterone, you have to look at estrogen. And then what I also tell people is it's not just based upon the test. So the science of the Dutch test is the test says this, but then the art is in the journey. And it's you saying to that patient, how are you doing? How are you feeling? How's your mood? How's your skin? How's your libido? How's your mind? All of those things factor into, because the art talks about how you can move those things around knowing what we're up against. So that's where we don't just like, hey, take this and let's talk in 6 months.
Absolutely.
Like, that doesn't fly
No.
from that standpoint. So, all right. Well, there you have it. Hey, always a fun chat with you.
Yeah, always fun.
It's always good to be down here. So if you are not already following Emily on social, she is at Hormonal House Calls, and we'll link that in the show notes. There, I think she just hit 1,000 followers on, was it TikTok or Instagram? Which
One of the two.
One of the two, which is awesome, right? That means that you have the ear of people, and that there's some things going there. So go and follow. There's a lot of cool things. I think, did you just shoot a video about like some house swaps or something like that?
Yeah. House swaps to swap out endocrine disrupting agents, and I did one on some cosmetics too. So yeah, cool stuff over there.
There you go. So tons of information for yourselves inside of that. So Emily, have a great day.
Thank you.